Greetings. My name's Jeanette Spreadborough. I'm a doctorate nursing student at Gonzaga University located in Spokane, Washington, and I'm in the doctorate program for the family nurse practitioner, and I'll be graduating spring of 2022. During this YouTube video, I'm going to discuss H.R. 1222, Congenital Heart Futures Reauthorization Act of 2017, and how it relates to my doctorate nursing project to screen heart failure patients for depression. I have been a registered nurse for over 20 years with extensive experience working on ICU units with cardiac heart failure patients. I've also held the role as a hospital administrative nursing supervisor as well as a nursing manager during my 20-year career as a nurse. I have learned over my 20 years as a nurse in acute care that there is a need for prevention that starts in primary and ambulatory care. I'm an active member of the American Nursing Association as well as the American Association of Critical Care Nurses, and I'm a certified critical care nurse and have my CCRN. I'm also a member of the Washington State Nursing Board of Nursing, and I'm also a member of the Inland Chapter of Critical Care Nurses located in Spokane, Washington. I'm excited to earn my doctorate family nurse practitioner degree and work in primary and ambulatory specialty care clinics where I can help identify gaps in practice and implement and facilitate quality improvement for the delivery of patient care. My doctorate project has a focus on a gap in practice, an ambulatory heart failure clinic located in Coeur d'Alene, where there is an identified gap in practice for depression screening for advanced heart failure patients. I'm interested in H.R. 1222, Congenital Heart Futures Reauthorization Act of 2017 that was signed by the President of the U.S. and became law on December 21st, 2018. I'm particularly interested in this law because it helps to coordinate federal congenital heart disease research efforts and to improve public education and awareness of congenital heart disease with a requirement for the Centers of Disease Control and Prevention regarding congenital heart disease to enhance and expand research and surveillance infrastructure and plan and implement a public outreach and education campaign. The CDC must award grants to nonprofit entities to conduct a cohort study of congenital heart disease from birth to adulthood. That considers healthcare utilization, demographic factors, and outcomes. Also, the CDC must award grants to nonprofits for awareness, outreach, and education campaign regarding congenital heart disease and how it impacts the lifespan of individuals. Bill H.R. 1222 for Congenital Heart Futures Reauthorization Act of 2017 was prompted by the current congenital heart defects research activities implemented by the Center for Disease Control and Prevention. The CDC is working with at least 43 states who have passed a law regulating hospital guidelines requiring hospitals to screen newborns for critical congenital heart disease. The remaining 7 states support screening newborns in hospitals, even though they do not require it. In 2011, screening for critical congenital heart disease was added to the recommended uniform screening panel for newborn screening. Since then, the CDC has been researching how well critical congenital heart disease works, the concerns of states and local governments involved in carrying out screening, and the health outcome of babies who get screened, and how they go on to become adults living with congenital heart disease and how depression can impact that. The proposed objectives of Bill H.R. 1222, Congenital Heart Futures Reauthorization Act of 2017, is to amend the Public Health Service Act to coordinate federal congenital heart disease research efforts to improve public education and awareness of congenital heart disease. The first objective of the bill is to enhance and expand research and data collection efforts related to congenital heart disease, including to study and track the epidemiology of congenital heart disease to understand health outcomes for individuals with congenital heart disease across all ages. The second objective of the H.R. 1222 is to conduct activities to improve public awareness of education related to congenital heart disease, including care of individuals with such disease. This includes adults who may suffer from depression, because related to their congenital heart disease. The third objective is to award grants to entities to undertake activities to study the incidence and prevalence of congenital heart disease in the United States and the causation and risk factors associated with and natural history of congenital heart disease, and study healthcare utilizations by individuals with congenital heart disease. The issue of Bill H.R. 1222, Congenital Heart Futures Reauthorization Act of 2017, and how it relates to my Doctorate of Nursing project, is to implement a depression screening protocol for heart failure patients, is that there is a growing population of adults with congenital heart disease due to improved survival beyond childhood because of the progress that we have in healthcare technology. It has been suggested that adults with congenital heart disease may be at increased risk for mental health problems, especially depression, according to the World Journal of Cardiology. There is an increased evidence for a higher depression rate in congenital heart disease populations versus the general population. Risk factors for an abnormal emotional adjustment and depression include early exposure to stress from illness and medical intervention in infancy, separation from parents during hospitalization, and organic brain syndrome. Later in life, patients often have to cope with physical limitations. Healthcare providers of patients with congenital heart disease should be aware of the mental health challenges and take more proactive approach to identify adult patients who live with congenital heart disease, which is heart failure for depression. The key elements of Bill H.R. 1222, Congenital Heart Future Reauthorization Act of 2017, is that it will facilitate evidence-based practice related to care and treatment for individuals with congenital heart disease. H.R. 1222 will help to appropriate funding to help collect data on the health outcomes, including behavioral and mental health outcomes, for a diverse population of individuals of all ages with congenital heart disease, such as that analysis of the outcomes will inform evidence-based practice for individuals with congenital heart disease and consider health disparities among individuals with congenital heart disease. H.R. 1222 would direct the Secretary of Health and Human Services through the Centers of Disease Control and Prevention to enhance surveillance capabilities, to track the epidemiology of congenital heart disease, and to provide grants to study the epidemiology of congenital heart disease across the lifespan. H.R. 1222 would authorize the appropriation of a total of $20 million for the fiscal years 2018 through 2022 to carry out those activities. Additionally, the bill will reauthorize research on congenital heart disease at the National Institutes of Health and would require the NIH to produce reports on its research efforts on congenital heart disease. Since there's an increasing population of adults with congenital heart disease and there is little systematic knowledge about the evidence-based therapeutic interventions for depression in adults with congenital heart disease, H.R. 1222 will provide necessary funding and requirements for the NIH to undergo research for people living with congenital heart disease. In conclusion, it is important to bring awareness that it is an important public health goal to increase the awareness of adults with congenital heart disease and their medical caretakers for the significant incidence of depression in this population. The exact incidence of depression in adult congenital heart disease population is unknown. It is clear that these patients will potentially benefit from routine mental health screening for depression. H.R. 1222 grants need to be appropriated to further research by the NIH. Thank you for listening, and I hope this has been an educational experience for you.